Yeah, sure. So we were looking at what a blueprint of pharmacy basically means for us as pharmacists, and also the interplay of that between community pharmacy and also within ICBs and primary care. And me and my two colleagues, Manish and Shilpa, we discussed how that starts with system-wide level changes, and also how that then goes into community pharmacy and also within the NHS 10-year plan, which we sort of think is the blueprint for pharmacy. We looked and we explored at how funding can influence that and where the money should be sitting, especially creating like a national formulary, but also crucially how the workforce is currently not included within the negotiations, and what a difference that can make if we start including the voices of the workforce right up front when we actually want to start talking about service development and service implementation. Looking at previous experiences, for example, in Pharmacy First, the launch was a little bit disastrous when you think how it could have been done differently and potentially better if the workforce were asked, how are you going to deliver all of these things? And we were involved in those conversations. But also we were looking at future focus about changes within neighbourhood health and how it's moving towards community models away from hospital, more into prevention, and actually what pharmacists can do in order to help with all of those national agendas that are being pushed through. But we also looked at what's currently missing. So the operational plan, for example, underpinning the 10-year plan, that's currently missing. We're waiting for that. The workforce plan, we should be having the workforce plan by now as well, to see how pharmacists are ideally, as they say it, located in order to deliver on the NHS 10-year plan for us. The key points for me is that the blueprint and the 10-year plan is an absolutely ideal time for us to look at the opportunities, but also the risks involved with that. Obviously, the opportunities involved in independent prescribing and pharmacists taking additional roles, but crucially also the risk in the first 1,000 days of pharmacists coming out from university, registering as an independent prescriber, their new roles, and who's actually looking after the strategy and also the plan for those pharmacists. But huge opportunity for us, but also we need to be aware of the risks and manage them appropriately.